Alright guys, so yesterday we talked about the structure and the function of skin. What are the three functions of skin, Eddie?
Regulates temperature, it's waterproof. Can't do that.
Lauren?
It stores stuff like fat and water.
Yes. What else? How does it control body temperature?
Dilating and contracting.
Constricting.
Constricting blood vessels.
Good. And what's the third one?
Sweat.
Sweat. Good. What is the very top layer of skin? Most superficial layer? Epidermis. What's underneath the epidermis? The dermis. And underneath the dermis? What?
I don't know, it starts with an S. I just can't pronounce it.
Subcutaneous tissue or subcutaneous layer. And then there are 5 layers that make up the epidermis. What are their layers, starting most superficial? Stratum, corneum. Remember, Carl loves great sex games. CL. What? Stratum corneum. Stratum. What's the L one? Lucidum. The G. Say it again. Granulosum. And the next one? Stratum spinosum. And then the most deep layer, stratum. That's right. Germinativum, or I don't know how to say it either. Alright, so then there's the dermis, which is a lot thicker. It's many times thicker. It's got the blood vessels, and that's the layer that actually does the heat regulation. It also has nerve receptors in it. So if you get a degree burn, the more degree it is, the higher the degree, the further down it burned. Subcu layer is under the dermis. I don't think we talked about hair yesterday. Hair has a root shaft. The root is what is actually in the skin. The shaft is what is coming out, which you can actually see. The shaft is what's coming out of the epidermis. Then there's the cortex, which is the outer part of the shaft. And then it has the inner medulla. It's the most inside, or the core. The hair follicle is what has to be, you have to, if you pull out someone's hair follicle, then you can get their DNA. It is the root is embedded in the hair follicle, which is in the epidermis. The erector pili muscle is what is attached to the hair, and when it is stimulated or when it flexes, it makes the hair stand on end. And that gives us goosebumps, or goose pimples, or goose flesh. When we have the goosebumps, a little bit of oil is secreted. That's not really important for me that you know that. But it's due to the pressure of sebaceous glands. Nails. Nails have a hard structure on the dorsal side of the body, or the hand. Why are the nails on your fingernails on the dorsal side of your hands? Why is it the dorsal side? Why? No, this is kind of a trick question. If it weren't dorsal, if your fingernails weren't on the dorsal side, what side would they be on?
On your bottom.
On the front.
What's that called?
Anterior ventral side.
Ventral. So, why are fingernails on the dorsal and not on your ventral? Why are they considered on your dorsal side, not on your ventral side?
Doesn't it have like sensory or something?
No, you're thinking too much. This is easier. Back up.
Did you use it? I don't know.
No. Back up even more. You guys are thinking too hard. You're doing good, but
Because it's not in the right place. Does it have something to do with like the
your
That
position.
position?
Yes.
your palms are?
That's right. When you're in anatomical position, your palms are forward, so that puts your fingernails on the dorsal side of the body. Does that make sense?
Yeah.
Good job of trying to wiggle around and figure out what I was trying to get across. All right, so fingernails are on the last phalange. Our fingers are made up of phalanges, and the free edge is what you have to clip or file. Your fingernails grow faster than your toenails. For some people, they're thicker too. You know, everybody has a different size or thickness.
Thinness.
What?
Or thinness.
Thickness, less thick. The nails grow from the nail bed or the matrix, which is the proximal end of the fingernail. Unless you have an injury or a disease, your nail will keep growing from that nail bed. So if you have trouble with ingrown toenails and you want your toenail to be taken out, then they have to actually remove or injure part of your nail bed. And if you guys would like well, I guess I should ask you first, Lauren, but not right now, but maybe you could show us. Is it
Gross, nasty toe?
is it still looking gross?
No, it's scabbed over. Like some people, it freaks out. I think it just looks a lot better than earlier.
Yeah.
I still have the before picture. I don't know if I have
Did
right
you-
after.
Did
That's
they take
okay.
the back part or just the front part only?
They took out the whole nail. Like there's still the nail bed. So they only take that out if you pilot it, and if you find an ingrown toenail 5 times.
So it's gonna grow back. I didn't realize that.
Yeah, they make it so it can grow back, but they can pull out the nail bed if they're tired of taking out your nail.
See, I didn't know that. I had the corner. I only had a small part of actually the most medial part of my nail, both greater toes, your big toe. I had both medial parts removed, and it was the first time. I mean, I have ingrown nails. And I'm diabetic, which is you don't want an injury to your feet because of circulation. But anyway, it's permanent, but you can't even tell, which I think is nice because I wanted, pretty painted toenails, and you can't even tell. That's what I'm trying to get at.
I have my fingernail long.
Your fingernail?
Yeah.
Oh, that just hurt. That hurts just thinking about it.
My finger was shot all the way in a door, in a truck door, like a big Dodge.
I had all 4 of mine stuck in a door.
And it was completely shut and it was locked. And it like took a really long time. And I was so,
How old were you?
it was the end of my sophomore, or the summer before my junior year.
Oh.
And I was like, my adrenaline was going so fast, it didn't hurt me. I didn't even feel anything, but I have x-rays where like my bone was broken, and it was like pushing up towards the top of my fingernail.
So what side of your fingernail?
I don't know.
Front wouldn't be posterior.
Dorsal. Back.
Front wouldn't be dorsal. Didn't you say
I
the
don't
front?
Did I say the front?
Did you? Is it the front or the back? Top or bottom? Never mind. Go ahead. Please continue.
It was pushing up on it.
Okay.
Anyways, and so what they did, they like numbed my whole finger, and they didn't like cut it out. They like pushed my thing back, and they got like these tweezer things and just ripped my whole nail off.
Anterior. Ugh. For me, they sprayed my toe with this super cold spray stuff, and it was so painful. They did one foot, and I was just like, oh my gosh, it hurts so bad that I was just like, I don't want that. Just go ahead and give me the shot. A shot hurts more when it's got less surface area. So your toe would be more painful than your shoulder. We get intramuscular injections like a flu shot or flu vaccine. That's intramuscular. And that's a long needle. Back here, just a second, my thing isn't working. Come on.
In my tooth, they did like this big, humongous needle and put it in my mouth to numb my cheeks and stuff and my gum and stuff. They did it right now.
If you're going into the subcutaneous layer, you can tell where you're going. Below the epidermis, which is go below the dermis, and then subcu. That needle is not going to be as long as if you're going to the muscle. Muscle would require a longer needle because you're going another layer down. So just think about diabetics. If you're giving yourself insulin injections, a lot of times you give it in your stomach. And that needle doesn't have to be very long. However, a flu shot, think of how long that needle is. It's going a whole nother layer.
So does it go into the layer like where it's like white and stuff? Is that the layer you're talking about?
That's the dermal layer. No, the subcutaneous is the very bottom,
It's like
the yellow.
sandy kind of. Okay.
Yes.
I had a When I had my last surgery, I had a leg block. They like blocked my whole leg through my back, and the needle was ginormous.
Yeah.
Huge, like the
Yeah.
biggest one I've ever seen.
They have a what?
She asked if I felt it, but no, it made me like really drowsy and like knocked me out before they did it. And then I went into this really cold room. It was like really sterile and everything. I want to have like a mask and stuff on. And I had to lay on my stomach, and they did it.
Where did they put it in? Straight in, or where did they do that? They didn't go into your back.
It was right. I think it was like something to do right here. It wasn't in the front. It was back here.
How about? Well, it wasn't. I'm talking about. It wasn't in your vertebra.
Oh, I don't really know. I showed blocked off my whole leg, like all of it.
I'm thinking it was more deep. Well, you know it had to be deep if you're having that long needle like that. But it probably going in. There are nerves that go closer to the ball and the socket joint. I don't know. Not right there because it couldn't anyway. What did you going to say?
Whenever I had this IV thing for 3 hours and they spray that stuff, that does not work.
I don't think so either.
Because they were going to try to do it in this arm, and whenever she put it in, after they sprayed it, and then they try to wipe it off, and then she put it in and popped the blood vessel, had to do the other arm, and that spray stuff doesn't work.
I'm not a fan of it. When I had shoulder surgery, I had a cervical block. That means it's going to that region. And they go in my neck, and they had to try to put me to sleep, not to sleep, but sedated me. I was drowsy. And
did you have to sleep on the couch for a while? My dad had shoulder surgery right in here.
Oh, is that not? That is the shoulder.
Yeah, I know it's on his shoulder, but he pulled something way back, and it wasn't. I don't know what he did.
Properly, maybe?
I don't know.
One time
but,
I was cutting
they did electric, they put the microscope in, they cut his skin,
scoped it.
Yeah.
That's what Ashley's gonna have. I had scoped, my knee was scoped, and she had her scoped They're gonna open it up this time, aren't they? So she's
They've opened
gonna,
it up all 3 times.
oh, they had it?
The first time, I have like, I don't know if I opened up the in-house scope, because I have little holes. I have 5 holes. And then the first one I had 5 little holes, and then the second one I had 3 that went like diagonal down my knee, and they reopened the bottom of my incision. And I don't know if they're gonna reopen that incision or what. I have to find out today after the mission.
One time I was cutting potato and the knife went through my finger, through my nail. Half of it. It was horrible. And I just put a Band-Aid on and cured it by itself.
Had to grow out.
It's like, I don't know. I used to have the, you know, how do you call those birthmarks? Little brown
Scars?
No, I had
Freckles?
Freckles?
yeah, like a little mole freckle or something, and I chopped it. It was like really backing out. It's not because it went through that part.
Huh.
Right here. It was like,
Huh.
it's horrible.
Alright, we're going catch back up.
Will we go over this again for someone that didn't get the beginning part?
I don't think so. Diseases, page 76, there's a little box at the bottom. It's kind of neat to read. I didn't know several of these. If you press on your fingernail, you will see that it turns white. When you release it, it returns to pink. So you can check several things. And that's what this box is. If you press it down, if you just are looking at your nails and they're white in color, you might have liver disease. If half is pink and half is white, you might be kidney disease. I don't know how true this is.
Aren't there like little white things in your nail, calcium buildup or something?
No, that's the lanula, or lanula.
Like the little white things that move down your nail. You know what I'm talking about?
Oh, you're not talking about the bottom, the proximal white half circle thing. Oh, you're talking about like if you hit your
No. That's not right. Yeah. I heard that's calcium buildup.
I don't know what you're talking about.
Show her.
Oh,
I have them all.
I don't think so. If you just hit your finger wrong, it can make a white mark like that, or it may not appear right then, but I don't know medically. That's just my opinion. Could you put yours back there, please? All right, so if you have yellow, thick nails, you might have lung disease. If this one is true, if you have a pale or white nail bed, you are anemic. So that's the way, you know, if you ever go to the doctor and your nurse like presses down and looks to see how fast the blood returns, that's looking at your circulation. What's the amount of blood, you know, do you have enough iron in there? You need to get some more iron. If you have yellowish with a slight blush at the base, you could have diabetes. Mine don't look like that. Mine aren't yellow. Anyway, if they're bluish in color, you do not have enough oxygen. So stop holding your breath. Moving along. Sweat glands are called sudoriferous glands. It's kind of a fun word to say. Sudoriferous. Perspiration, or our sweat, when we sweat, is 99% water and 1% impurities, or the actual oil or the salt. Perspiration is excreted. It goes out through your pores. We looked at the sweat glands are in which layer are they in, Lauren? Very good. They're in your dermis. Sweat glands are under the control of the nervous system, and we lose 500 mLs of water every day through our skin. So that water needs to be replenished. So you need to keep drinking water. Ceruminous glands produce wax. Our ears have ceruminous glands. Cerumen is a wax, and it's earwax too. So how many mLs are lost through perspiration every day? I shouldn't say it. Well, yeah, you perspire through your skin.
15 liters.
How much? It's actually half a liter. We'll learn that conversion. 1,000 mLs are 1 liter. So 500 mLs are half a liter. Okay? We have sweat glands or sudoriferous glands all over our body. Where a large number of them are in our palms. So if you sweat a lot when you're nervous, that's why your hands feel sweaty. Your palms get, clammy. It's because you're sweating. We have them under our arms, of course. A large number located there. Another place is our forehead. I don't remember the other one.
Right here and then our nose.
Nose?
Like right here.
Oh, yeah. These glands can be activated by heat, pain, fever, or nervousness. Sebum is the substance that's secreted out sebaceous glands. And it's got amino acids, lactic acids, lipids, salt, and urea. I'm going to look at something. The sebaceous gland is by the root, hair root. Sweat glands produce sweat. Sebaceous glands, I think I said that wrong earlier. Sebaceous glands, remember I had said that when your erector pili muscle gets stimulated or flexes, it stands up, makes the hair stand up, and a little bit of oil it's not sweat, that's sebum, or from the sebaceous gland. I think I said that wrong earlier. But these oils help to keep our skin soft and pliable. It lubricates it. Yeah, right there. Sebum. Microbes, microorganisms. It is our first barrier to or defense to microorganisms. Our skin is. The best way is intact skin, or the best way to protect itself against pathogens. If you've got an incision or a lesion on your skin, it's going to allow microorganisms to get in there. So if you can, make sure you put some antibiotic ointment on there. Hair and sweat glands are very highly active or have a high number of bacteria. So when you wash hands, it's the best way to prevent the spread of disease. 20 seconds, or sing the happy birthday song twice. If you are dealing with something that's infectious, like blood, it could be infectious material, or semen. What else? Saliva, maybe? Fecal matter. 2 to 4 minutes for hand washing. aging, as we age, our skin becomes more fragile and dry. There's a loss of elasticity. I remember sitting in church with my grandma, and I would take her hand, and I'd hold the skin, you know, peel it back, and to see how slowly it was like molasses moving back. And I do it to mine, and you know, it's got, don't even get my hand away, and it's already back to normal. So that's the elasticity. You also are not as effective at cooling or controlling body temperature. That's one reason that the elderly are cooler. You know, they always need a blanket because they have a harder time with body temperature control. Their melanocytes decrease. Do you guys remember what melanocytes are? First of all, what is the suffix?
Skin color.
What?
Skin color.
That's melanin, or melanin. Yeah, you're right. Melanocytes. What is the, what's the suffix of this word? Melanocytes. Suffix? Sites. Did you say melano? I know, I thought I heard melano. Sites, yes, you're correct. What is the root word? Melon. What's the combining vowel? O. What's the combining form? Melano. Very good. There are also physiological changes, and that can impact self-worth. There's not as much collagen, you get wrinkles, saggy, poor elasticity. And we're going to stop there. We'll start with disorders tomorrow. We're probably going to have a test next week.
Already?
So what I want you to do right now is turn to your partner. No, let's do something more fun. Stand up.
Can you call Miss Rosie when she's
Okay, I want you to, everybody, let's see. Everybody come up here, please. Quick, 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 quick.
I have to change again for softball.
Do it again? Okay. Alright guys, so what I want you to do is take 3 big steps towards there, like you guys do it towards these people and these guys do it towards you guys. 3 big steps, and then so everybody should have one partner.
Those are like normal ones.
Or if we bump each other.
It's okay. I don't like this game already.
Okay.
No, Ashley, Jessica, you guys switch with Lauren and Haley. One of you guys with one of them. Alright, so then you're going to go find a place in the room. Hold on, don't start yet. And, shh. Okay, you can be with Colby and...
Wait, Rachel.
You can take mine. Rachel doesn't have one.
Alright, so you guys are going to find a place in the room, shh, and you're going to tell that person 3 things that you learned today.
I wasn't here, so I shouldn't play this game.
3 things that you learned. Go find a place in the room away from everybody else.
3 things I learned. How about you tell me 3 things I should know?
Who's your partner? Me? So what did you learn? You tell her what she learned, what you learned. I didn't pay attention. Why not?
got so many.
Then what do we do?
Go ahead, sit down at your seat. All right, guys.
I said hi in the camera because it was.
I forgot it was on.
Megan, what are you doing? Start reading my notes.
Eddie, what'd you learn today?
Well, skin's got 5 layers.
What are those 5 layers?
Oh gosh, I'm not sure. Can I look at my notes? Well, they're like, here, I'll look.
5 layers that make up which layer?
Whoa.
Wait.
I have to leave, miss. I'm
Is
gonna be
it-
late.
What did you learn today?
Learned about aging. I gotta do cameras. This is not happy.
What about aging?
That they don't they lose control of their body temperature and
They who?
old people,
What are they called?
elders. I don't know.
Okay, what else?
That they lose they lose their I don't know how to say it. Starts with an E.
Elasticity.
Yeah, that thing. They always have old.
Okay, that's good. Eddie? What about those 5 layers? What's the saying that